Welcome to the channel, guys. Another video with Russ Scala, expert in performance and TRT in medicine over 40 years and writer of The American Biohacker. He will talk about athletes and heart disease today. So, welcome, Russ.
Hey guys, how are you? I hope again I could shine some light on some areas that nobody considered. I could educate some people, and then we could ask the tough questions together.
Well, Russ, this is amazing. You have been researching heart disease over 30 years. You have been with the most advanced institutions. So, what did you learn about athletes and their heart health?
Yeah. One of the things I learned, folks, is I started working in the hospital when I was still in high school. I worked in the emergency room, and I was fascinated by heart attacks and all that stuff as a kid. And I became a paramedic and worked on hundreds of heart patients over the years. Thin, heavy. I worked on athletes. And as my education evolved, I left the SWAT team and paramedic training. I became a triathlete. And in the early 90s, I started seeing triathletes with heart blockage. I'm like, wow, why are these guys having blocked arteries? None of the cardiologists knew. I was in front of hundreds of cardiologists, Stephen, all over the United States. As the director of research for a large pharmacy, I had to come up with testing and treatment protocols for heart patients. I had to use TRT to rehab the heart. How does growth hormone affect the myocardium? Can we grow back new myocardial tissue? The heart beats 84,000 times a day. How is testosterone involved in the recovery? How does a ketogenic diet affect the heart on a cellular level to increase mitochondrial biogenesis? Those are some of the things I went after. So heart disease is killing more people worldwide. Heart disease needs to be a gender-specific treatment protocol. Men and women, we need to treat heart disease differently. Now, when I started seeing this in men and women in the early 90s, I would finish a long-distance triathlon, and then I would hear stories of people having heart attacks that were extremely fit. So that was ground zero for me to start asking questions. I started running tests on endurance athletes in the early 90s. And what I saw was essential fatty acid imbalances, low testosterone, and low thyroid that impacts the endothelial lining. All heart attacks start with endothelial dysfunction, high calcium, soft plaque rupture. Now, there's blood work that you could order. I flew to Athrotech to meet Dr. Kenneth French, the chief lipid science officer for a company that did lipid subfraction testing. They knew nothing about TRT up there at the time. So this program that I developed for the heart, I put 30 years of research and open sourced it on the Russ Scala YouTube channel. It's about 15 minutes long, but it's called High Calcium and Heart Disease in Athletes. I put it out there free because too many people have died of heart disease. I've met venture capital guys that said I needed to take it down and I needed to license this. I didn't. This is open sourced, all right? So the people here on your Facebook page, Stephen, this is all new. Heart disease research they'll never hear anywhere. And they can apply to their life. Because TRT is very important for protecting the heart. We've got testosterone receptors on the heart, okay?
So in general medicine, a lot of doctors think that TRT, giving doses of testosterone, is dangerous for your heart, for heart attack. So how do they get that idea?
Well, one of the things I want the guys here, everybody here to understand, you can learn more about protecting your heart with TRT in a very short period of time with Stephen and I than you can from any cardiologist. Because I'm dealing with cardiologists right now, and they can't even believe, they still think fat's bad. We need fat in our diet, right? We need fat in our diet. Heart attacks comes from high sugar, not high fat. It comes from endothelial dysfunction. Think about your arteries like a wall, and that wall gets scratched. And then the repair protein is released, and that's how the arteries become blocked over time. I've got guys I'm working with right now with a calcium score of 1,400. 400 is bad, right? So again, every heart patient, every guy in his 40s needs to be on TRT to protect his heart. The heart is one of the most metabolically active tissues in the body, beats 84,000 times a day. On a cellular level, has more mitochondria than any other part of the body. So if you're working out your bicep, one cell in your bicep may have 300 mitochondria. One myocardium cell in your heart may have 3,000 myocardium. mitochondria. So understanding mitochondrial dysfunction and how TRT, listen, testosterone on the cellular level creates less free radicals, okay, than anything out there. So the combination of testosterone, the ketogenic diet, when your body produces the ketone beta-hydroxybutyrate, your heart will utilize testosterone beta-hydroxybutyrate more efficiently than any, and it will impact more metabolic pathways than any current drug on the market. And this is what's not being done worldwide. Steve, what we're talking about today hasn't been discussed anywhere.
Amazing. Thanks for bringing that to us, Russ. But
Sure.
what is the exact answer to the question, why are endurance athletes and bodybuilders having heart attacks and stents as well as bypass operations more than the general public? How is that possible for these athletes?
Well, it's not. It's probably not more than the general public, but I always, since I'm an 11th hour interventionist, I study the outliers. So when I worked inside an imaging center, we imaged the heart. The heart of an endurance athlete and a bodybuilder are completely different. They look like they got hypertrophic cardiomyopathy. Why is it that the ejection fraction of a bodybuilder sometimes is very low, or an ejection fraction should be around 50? And some of the bodybuilders, it's very low. Could that be from the anabolics? Can that be from carrying too much muscle? Too much muscle is just as dangerous as too much fat, but I don't want to upset the bodybuilders because I learned a lot from bodybuilders. I love those guys. But the endurance athletes think fast race times are healthy. So here's what I found out. If you have high cortisol with physical, mental, emotional stress and low testosterone and low thyroid, you will damage the endothelial lining, okay? You will damage the endothelial lining. So think about the walls of your arteries release a gas called nitric oxide. We could test that with asymmetric dimethylarginine, all right? So now you're under physical, mental, or emotional stress. If you Google low thyroid and endothelial dysfunction, you will see low thyroid will block the arteries faster than smoking 2 packs of cigarettes. Low testosterone and endothelial dysfunction. If your testosterone levels are low, it's going to affect your heart beating 84,000 times a day. So endothelial dysfunction, that's what causes the blockages of the arteries. So now, when I get a stent patient or a bypass patient, what do I have to do? There's something called restenosis. If you put a stent in a guy's artery or he has bypass surgery, those arteries can become blocked in 6 months. So how do I prevent those arteries from restenosing or getting blocked again? I look at insulin, which is inflammatory. I look at hemoglobin A1C. High blood sugar will cause a high amount of free radical damage. Like when you cut an apple in half and that apple gets brown, that's what will happen to the arteries. So you need to look at antioxidants, testosterone. You need to look at thyroid function. And I developed a restenosis program that I just gave to a couple of cardiologists. And they're like, you're just going to give this to us? I'm like, you got 5,000 patients. Go do something. Because for me to present this at a cardiology center, they wouldn't even let me on stage.
It's unbelievable with that top of the spear research done.
Yeah, exactly. And like I said, Stephen, what we're sharing here is not shared in any TRT Facebook page yet. None.
Mm-hmm. Okay, well, thanks, Russ, for bringing this to us. And maybe remind viewers how they can reach out to you, how they can work with you.
Hey, guys, one of the things you could help me with is I want to educate you guys so I could kind of clone myself a little bit through you guys. And I created the Russ Scala YouTube channel. Send out my heart stuff. Educate people. I need you guys to educate people. You can see Scala Precision Health, my company here in Orlando, where we do very high-level treatment protocols. And then you can download my book, American Biohacker, and write a review for me for like $4. And thanks, Stephen, so much for having me on. I love doing this.
My pleasure. Thanks for having you, Russ. See you next time.
All right, brother.